Let me see your muscle. You gotta hold him up high, mama. Yeah, hold him up high. Look, you gotta look over there. Strong. Say,
She loves fruit snacks, babies. She's so friendly. She speaks to everybody. Even when she had her procedure here, they called her the mayor of the 10th floor. She fit right on in.
I'm a heart doctor. You ready to get some pictures taken of your heart?
She was born with the heart murmur, and she was recommended to have a heart procedure. The way her heart beats is totally different because it sounded like a space. It was a space in between, but you can't hear the space anymore. Like if I lay on her chest, I could hear it. But now, when she used to run and stuff, you can see it, like you can hear it when but now, no, nothing.
So Jayani had what's called an atrial septal defect, and that is a communication in the tissue that divides the upper chambers of the heart called the atria. We closed that with a device. And the way we did it is by sticking a catheter, which is basically a long tube that's about the size of a piece of linguine. And we were able to snake that all the way up the vein in her leg and into her heart. And we actually went across the hole. We were able to introduce a device through that long tube, which then plugged the hole. This white part is the actual device. There's one side that goes on the left atrial side, and there's one side that goes on the right atrial side, and these two discs fill the hole, and basically it gets encased in scar tissue and essentially disappears from the body. It's as if it's never there after 6 months. So what's so exciting about this procedure is that the recovery is very quick. That catheter that I showed you is extremely small, and there's virtually no scar that's left over. She spent the night in the hospital and was able to be discharged the next day. It's very exciting. They basically go back to a normal lifestyle within a couple of days after the procedure.
Here. Okay, last one. Okay? It's not hurting, right? And one more here.
Good
job. All good.
Her care here was amazing. It was our first time being here, and they took good care of us. I was a nervous wreck. I really was, because I knew about it since she was born, but it was like it took a lot out of me to actually have her cut. But coming here, it was a breeze. Like it was so easy.
Her prognosis is excellent. We will continue to follow her with echocardiograms. We got one month after the procedure. She'll have another one at 6 months, and then yearly from then on out. And if she's doing excellent from then on, we might even space them out to more infrequently than that. But we expect a full recovery, and we don't expect any kind of decrease to her lifespan or any long-term complications from the procedure.
From the nurses to the doctors, everybody has been amazing. Even though we've seen so many people, but everybody has the same aura and energy. Like they have a good energy. And it made me feel very comfortable. It's a win-win. I love it here.